Hello, my name is Andres Gomez, and I work in the acute leukemia and bone marrow transplant program at Hospital Universitario in Monterrey, Mexico. So relapse is the major cause of death for patients with acute leukemia who undergo allogeneic transplantation. In our university, we often treat adults with so-called clinically defined high-risk acute leukemia who have either a difficulty achieving remission or have undergone multiple treatment lines, as we lack alternative therapies or access to clinical trials. For patients with both AML and ALL, we routinely take a single bone marrow aspiration at day plus 30 and day plus 100 after transplantation and perform a measurable residual disease assessment following the Euroflow protocols and ELN recommendations. In this study, presented as a poster as ASTCT 21, we retrospectively assessed the outcomes of 72 adults who had undergone peripheral blood marrow match-related or haploidentical transplantation using a myeloablative conditioning regimen. 50% had a negative pre-transplant MRD, and a similar proportion had a high and very high disease risk index. We found that despite achieving a negative day plus 30 MRD status after transplant, early relapse still occurred in 72% of patients with ALL and 44% of patients with AML. And although day 100 MRD positivity was associated with a worse overall survival, still more than 60% of patients with negative day 100 MRD relapsed in both disease groups. Furthermore, at day 100, identifying an unsuspected relapse with more than 5% blasts was more common than identifying an MRD level disease burden. Performing an intermediate assessment may offer a small window of opportunity. Complementary assessment through molecular and genomic techniques for MRD may provide a better alternative. If resources are constrained and preemptive therapy is not planned, not performing an MRD assessment and relying on traditional morphological assessment is also acceptable. Thank you.